The risk of becoming severely ill with the virus appears to increase among people with pre existing non communicable diseases, such as cardiovascular diseases, chronic respiratory diseases, diabetes, and cancer. Here are a few tips for people living with NCDs on how they can protect themselves during this pandemic. Continue to take your medication and follow medical advice. Secure a 1 month supply of your medication or longer if possible. Keep a distance of at least 6 feet from people with a cough, cold, or flu like symptoms. Wash your hands often with soap and water. Quit smoking and avoid using coping strategies involving alcohol or drugs. A healthy lifestyle will make all bodily functions work better, including immunity. Eating healthy diets with plenty of fruits and vegetables, keeping physically active, quitting smoking, limiting or avoiding alcohol intake, and getting enough sleep are key components of a healthy lifestyle. The Ministry of Health encourages persons with non communicable diseases to manage their conditions as much as they can so they do not end up in the hospital. For more information, go to coronavirus.gov.bn. Stay well, Bermuda.
This is a message from the government of Bermuda.
Good afternoon. The gradual return of activity on our streets and the efforts of hardworking men and women in business to adapt to a rapidly changing model of customer service should have been seen by everyone. Slowly, there is growing economic activity in Bermuda, and some people have been able to return to work. As we go about our daily lives, the same precautions must apply, and we know what they are. Frequent and proper hand washing, physical distancing and the proper wearing of masks, the ability of more of our families, friends, and neighbors to return to work and earn the living that provides for their families depends on our collective efforts to reduce the spread of this virus, which, if not done, can infect our vulnerable and overwhelm our healthcare system. Last week, I signaled that Cabinet would meet on the weekend to discuss Bermuda's move into phase 2 of our multi-phase plan for reopening. Yesterday, ministers considered input from our caucus colleagues, the latest public health guidance, and weighed the benefits and risks of moving into this next phase. Your concern is our concern. The transition must be measured, emphasize safety of our people, and return as many people to work as safely as possible. We believe that what we have determined achieves that goal, and that it is indeed time to move Bermuda into phase 2. With effect from Thursday, May 21st, these are the changes that you can expect. Retail stores will be open for in-store customers, and they will be occupied by 20% of the building's approved maximum fire occupancy inside at any one time, and will follow the same alphabetical shopping days in place for grocery stores and gas stations. Beauty salons and barbers will open under strict public health requirements, which the Minister of Health will expand on. Restaurants, both standalone and restaurants in hotels, will be able to open for outdoor dining only. Licensed bars with outdoor facilities will be permitted to open on the same criteria as restaurants. To ensure the safety of both workers and patrons, restaurants and those licensed bars slated to open in this phase will only be permitted to do so with the approval of the Ministry of Health. The environmental health team will work with restaurant owners and operators and bar proprietors who have outdoor facilities already to ensure that they are able to meet the strict standards required to begin serving patrons again. This means if you do not have the requisite permissions, it will still be unlawful for you to open on Thursday. Outdoor weddings and funerals will be permitted with a maximum of 20 persons outdoors in attendance, subject to the proper wearing of masks and appropriate physical distancing. These two services are the only times where more than 10 persons can be gathered. Apart from that, the restrictions for gatherings of 10 in public and or private remains. Requirements for those boating to be from the same household will be removed, but still only a maximum of 10 persons will be allowed on any boat, subject to appropriate physical distancing. And that means that you cannot have 10 persons on a 20-foot Boston whaler. We must be responsible. Following consultation with Bermuda Pediatric Association, playgrounds will be open, and licensed daycare centers can apply to the Minister of Health to again open their doors for childcare. This is especially important for our essential service workers. The use of outdoor gym equipment in our public parks, which was prohibited, will now be allowed. However, anyone using this equipment should sanitize this equipment prior to public use. Remote working and working from home will still be required where reasonably practicable. All businesses permitted to operate will operate between 7 a.m. and 9 p.m., as the 10 p.m. to 6 a.m. curfew will remain in effect. The reopening of these services will mean an increased need for enforcement and compliance. We are focused on the health and security of people at all times, and this includes service providers as well as customers. The Bermuda Police Service and the Royal Bermuda Regiment will be checking for adherence to public health standards regularly. The team at Environmental Health will provide training to these officers to assist them in monitoring physical distancing and public health standard compliance. It is our intention that these changes will be in force into next month, and therefore on Friday, I will table the revised regulations in the House of Assembly and invite the House and thereafter the Senate to approve their extension through to June 30th. This extension to June 30th does not mean that there will be no more changes over the next 6 weeks, but it is required as the current regulations expire at the end of May. Collectively, if we do our part, we can advance to future phases, allowing more persons to return to work within the next few weeks. With the expansion of services available in Phase 2, there will be parents reporting back to work who will need to have continued educational support for their children who attend our public schools. The Department of Education is organizing an educational support program for children of parents who are able to return to work during Phase 2. Parents who may be returning to work from Thursday should send information to the principal of their school, the school that their children attend. Please provide the names of your children and their grade level, and please submit this information no later than Wednesday, May 20th. This information is critical so that the department can know in advance the number of children that they should plan for. The educational support program will focus on students continuing their remote learning, but in a different venue other than home. The program will be administered as a supervised, controlled environment. To be absolutely clear, the program will service the children of those parents who must physically return to work, resulting from changes in the regulations. The program at this point will not be equipped to accept children with special needs. Now, the Minister of Health will present today's COVID-19 results and give more details regarding this move to Phase 2. Minister of Health.
Thank you. Good afternoon, everyone. Between Sunday and today, there were 532 test results received by the Ministry of Health, and 2 were positive for COVID-19. Bermuda now has 125 total confirmed positive cases, and their status is as follows. There are 39 active cases, of which 35 persons are under active public health monitoring, and 4 persons are hospitalized, of which 2 are in critical care. A total of 77 have now fully recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 59, and the age range of all of our positive cases is from 18 to 101 years of age. The average age of persons hospitalized is 74, and their age ranges between 70 and 78. The average age of all deceased cases is 74, and the age range is between 57 and 91 years. Excuse me. The source of all local cases is as follows. 39 are imported, 74 are local transmission with known contact, 8 are local transmission with an unknown contact, and 4 are under investigation. And Bermuda's country status remains at low transmission with clusters of cases. As we move into phase 2, the Ministry of Health will be creating clear guidance instructing what permitted businesses must do during this phase and what it means for certain sectors. This guidance will be posted on the government website at coronavirus.gov.bm. One such guidance note that has been created for phase 2 is personal services guidance for the consumer regarding limited operations of beauty, hair, and barbershops. And I do stress the word limited. Under phase 2, hair services, including hair cutting, styling, and barbering services, will be permitted. Services requiring hair washing are permitted, but clients should be encouraged to come with pre-washed hair for express services unless chemical services are being scheduled. Pedicures and manicures, including gel and acrylic nails, will also be permitted. Not permitted under phase 2 are beauty services requiring the following: a client to disrobe, such as for massages, body wraps, or waxing; permanent makeup, such as eye or lip liner, or any tattoo style services; electrolysis or laser hair removal; and extensive touching of the body of a client's body, such as shoulder or back massages, pedicures and manicures with add-on massages or paraffin wax treatments. The reason for these prohibitions is that they require extensively close contact and touching of a client's face and body. These activities dramatically increase the risk of spreading COVID-19, so are very high risk and cannot be permitted at this time. While it is true that in healthcare settings, it is sometimes necessary to touch and get close and very close to a patient at times, this is done only when medically necessary and with appropriate PPE. Grooming and beauty treatments are not essential care and could justify the level of risk. So, ladies and gentlemen, in phase 2, these treatments cannot be permitted. In addition, mobile services or home visits are not permitted in phase 2. Again, the reason for this prohibition is that it would increase the risk of spreading COVID-19. Performing these services underground, outside regulated premises, will simply pose a health risk for the stylists, the client, and their families. So do not attempt to undertake this activity. Mobile or home beauty services are not allowed at phase 2. Salons operating during phase 2 should take a number of steps to prepare to serve you safely during this period. These measures will help to protect you, the customer, and those providing the services, and they include the following. 1, signage. You should expect to see additional signage indicating that your salon has taken steps to prepare to serve you safely during this phase. 2, physical distancing policies, barriers, and shields. Your salon may have implemented physical barriers at service counters, between stations, or you may notice that the salon serves less customers while you are there. These efforts are important for physical distancing. 3, increased hand washing and use of sanitizer. You should be asked to sanitize your hands immediately upon entering the premises and you should notice increased hand washing and cleaning from your stylist. 4, questionnaires about your health. To protect the stylist, you will be asked questions about your health. Do not attend if you are unwell or if you have been around someone who has symptoms of COVID-19. 4, recording of client contact details for contact tracing. Be prepared to provide more information. Public health officials may require additional information during an outbreak. Your salon should ask for detailed contact information for this purpose. 6, increased cleaning and sanitation of the salon. Cleaning in between customers must occur for chairs, touch points, and workspaces. Be patient as salons complete this in between clients. 7, use of masks and other PPEs. Personnel in the salon must be wearing a mask, and you must wear one whilst you're there as well. If you forget your mask, call ahead to see if your salon provides them. And I should note that businesses and patrons are responsible for providing their own PPE. 8, increased cleaning of tools, brushes, and implements. Your salon must always provide clean tools, and that includes clippers, guides, brushes, and combs, and new disposable implements such as nail files and buffers. If you are unsure, ask questions. Further guidance will be posted over the coming days for other permitted businesses, including retail and restaurants, which will be open for outdoor dining only, and that includes bars as well. Lastly, the public will be aware the bus services are intended to resume with a 3-foot distancing requirement and mandated wearing of masks on all buses. This reduced physical distancing has been permitted by public health for public transport only, as it is an essential activity for the resumption of work and economic life. Its necessity justifies the risk as it is mitigated by the mandatory wearing of masks. The masks reduce the risk, but the physical distance should also be as great as possible in all other settings. And it is a combined measure of hand hygiene, physical distancing, and mask wearing that create this protection. Other jurisdictions are adopting similar measures in order for public transportation to be able to operate. For those relying on public transportation, please be mindful of the following. In addition to the requirement for wearing a face mask, keep a distance from fellow travelers to a minimal of 3 feet. Avoid rush hours if possible. Try as much as possible to face away from other travelers. Avoid physical contact and cover your face when coughing or sneezing. The key thing is not to be too close to other people for more than a short amount of time, as much as possible. The risk of infection increases the closer that you are to another person with the virus and the amount of time that you spend in close contact with that person. You are very unlikely to be infected just walking past another person to take up your seat 3 feet away. And I end by reminding us all that if we do not adhere to public health requirements, we will see increases cases of COVID-19, increased hospitalizations, and increased deaths. As we transit through the reopening phases, it is not to return to life to normal. It will never be normal again while there is no vaccine or cure for COVID-19. The phases aim to allow time for cultural and behavioral change so that together we can prevent having another shelter in place in the future. The new normal is all about hand hygiene, physical distancing, and wearing masks for all of us. We must integrate this into our daily lives to ensure safe passage through this next phase of phase 2. And you can stay up to date, as always, and informed on the latest developments of COVID-19 by visiting the government website at coronavirus.gov.bm. Thank you.
Thank you very much, Minister of Health. Now we will have an update from the Minister of National Security, who will give an overview of the policing plan for phase 2 and also talk about the third sector support and donations received. Minister.
Thank you, Premier. Good evening, Bermuda. I wish to start by extending my condolences to the Santucci family on the death of their loved one who was killed on Saturday night. These are painful circumstances, and our community is deeply saddened by this tragedy. As a community, we are already under immense strain, and violent acts like this only add to the heartache and anxiety in our community. I would like to ask the community to please keep this grieving family in your thoughts and in your prayers as they mourn a loved one. Please be advised that one man is in custody, helping police with their inquiries. Can I ask for anyone who knows anything to please contact the police on 211 or on 295-0011. Last week, Friday, May 15th, a total of 97 residents returned to Bermuda on a Delta charter flight. 77 of the aforementioned persons are now being housed in a government quarantine facility for a total of 14 days. One of the challenges that we noticed on the last time was that in the quarantine facility, residents were being confined to their rooms for 24 hours a day. In an effort to make their stay more balanced and holistic, the Ministry of National Security has implemented a physical activity which would allow residents of the quarantine facility to be able to go outside and exercise. Classes such as walking, high-intensity training, yoga, meditation will be available starting this week. They will also adhere to social distancing guidelines and have been instructed by the Ministry of Health. This initiative has been made possible in collaboration with the Ministry of Health, the DERM, as well as members of the wellness community who have donated their time to this endeavor. As the Premier indicated, we will be moving into Phase 2 on Thursday. As Phase 2 gets underway, the Bermuda Police Service and the Royal Bermuda Regiment will maintain their community engagement and enforcement to ensure that the regulations are followed. A comprehensive operational plan is now in place, controlled by the Gold Commander of the Bermuda Police Service, Assistant Commissioner Martin Weeks, working in partnership with the Commanding Officer of the Royal Bermuda Regiment, Major Ben Beasley. Extensive police and regiment resources will be visible across the island to ensure businesses fully comply with the regulations. Visits will be made to the business premises to check on the following: physical distancing measures. The use of PPE masks were mandated. Required health regulation compliance in regards to cleanliness and sanitization. The appropriate numbers of persons within the premises. The enforcements and any other guidance set out by the Ministry of Health. Please note that advice will be given with reference to minor breaches. Serious breaches or repeated breaches will result in the immediate closure of a business, law enforcement action taken towards the proprietors. In certain cases, the offending businesses may not be able to reopen. Outside dining areas will be visited to ensure the physical distance compliance, and we also like to make sure that the health measures are being adhered to. Businesses are expected to publish the relevant guidelines to patrons in prominent places within their establishment. Please note that roadside sobriety checks will be in place to prevent alcohol misuse on the roads. The Coast Guard will be active to ensure that we have compliance on the water. Police and regiment officers will be present to ensure that patrons leave the establishments promptly at 9 p.m. Curfew will be enforced from 10 p.m. to 6 a.m. Persons will be arrested for breaching. Police and regiment resources will also be visible in public parks and other areas to ensure regulation compliance. Please be advised that we are working on a fixed penalty framework to address the regulation breaches will be set out in a system of on-the-spot fines for individuals and businesses. Non-payment will result in court action. Any member of the public that sees a breach by a person or a business can report their breach to the police in one of the following methods: by dialing 211 or reporting on the web portal at /portal.police.bm. With businesses preparing to reopen, I cannot stress enough how critical it is that all establishments have the appropriate PPE supplies and equipment available for their staff and their customers. To be clear, providing PPE is the responsibility. I'm encouraging the public and our businesses to please be mindful and responsible when engaging in these expanded services. If the guidelines are not adhered to in accordance with the emergency power regulations, this could result in a business being closed. Over the weekend, the Bermuda Weather Service provided an update on Tropical Storm Arthur. We expect this to become a subtropical storm this week, when it passes Bermuda. This is a timely opportunity for me to remind Bermudan that hurricane season starts June 1st, and now will be a good time for you to assess your supplies and make sure that you have everything for hurricane season. Even as we navigate COVID-19, I can assure you that all steps are being taken to ensure that we can deal with COVID-19 and be ready for hurricane season. Finally, I wish to take this time and this opportunity to extend my thanks and appreciation to the combined effort of the third sector, or our charitable organization. To date, the third sector has received $1.84 million into Bermuda's emergency fund for food supplies for our most vulnerable. Through their work, they have on average daily provided 10,000 meals for people in need. They have made 8,400 quarantine checks and calls to make sure that returning residents were in their rightful place. 200 mental health calls on average to support people suffering from distress, anxiety, feeling isolated, or being depressed. 33 women and 16 children. They have been assisted 33 women and 17 children fleeing violent situations requiring safe housing in 8 weeks. They have given support to 10 people for sober living. 28 people on average have been sheltered at the Salvation Army per night, and approximately 22 people per night in the government shelter. They've also assisted in testing and helping with the St. John's ambulance, transporting seniors to medical appointments, dialysis, wound care, and other health support. They have helped with water delivery. I wish to thank Ms. Myra Virgil and the charitable organizations who are members of the third sector emergency team for their service and for their dedication, ensuring that those in our community who are most vulnerable get the help and support that they need. Thank you. Premier.
Thank you very much, Minister, and I would like to join you in condolences to the Santucci family. Before I go to questions, I think it's important for us collectively to take stock of where we are and where we are going. As the success of the country isn't my success or the cabinet's success. It is the success of all of us, and we should all be collectively proud in our efforts. As a country, to date, we have managed to successfully contain the virus on our shores, and we've never moved to widespread community transmission. This is due not only to our decisive action as a government, but the continued cooperation of all of you. With the support of the Ministry of Health, the aid of young Bermudian Dr. Karika Weldon, numerous volunteers, and local community physicians, we created a government testing lab that enabled the island's testing capacity to expand dramatically, with Bermuda among the leaders in the world for per capita testing. We ensured that widespread testing is conducted at no cost to the persons being tested. We quickly identified facilities that could be used to quarantine arriving passengers for 2 weeks, then arranged for all to be tested prior to being released to their homes. This policy prevented further spread of the virus and is one of the reasons that we did not move to community transmission. While the hospitalization rate is falling, the Ministry of Health and the Bermuda Hospitals Boards have successfully added 48 additional beds to our stock of hospital beds to enhance the hospital's ability to care for patients with COVID-19 if needed. And through public and private sector efforts, we've expanded the number of ventilators available at the hospital with other measures to improve the ability of our hospital to respond to any future outbreak. We provided new and unprecedented support for our people economically displaced by COVID-19, with over $20 million paid out in support to those who are unable to work, and over $12 million being made available to small and medium-sized businesses. We've worked together as a community to support our most vulnerable members of society, the third sector, the churches, community groups, and citizens ensured that our seniors, vulnerable, and our homeless population were supported during this time. And we set aside petty political bickering and worked together across the political, philosophical, and ideological chasm that so often holds back our island's progress. We have done well as a country, and I'm grateful to everyone within the government, the legislature, the community, the unions, the private sector, and the third sector who have helped to get Bermuda where we are today. Though we have done well, we have not been perfect, and there are things where we could have handled differently. We concede that we could have moved faster to test all in our seniors' homes and been quicker to provide payment of unemployment benefits to those who qualified but didn't get them in a timely manner. However, despite those setbacks, as a country, we have done well, and we should all be proud. We have adjusted quickly to the changing circumstances, moved quickly to correct any missteps, and followed examples set by countries that are successfully managing COVID-19. We are grateful and humbled by the support, trust, and gratitude we have received from the community and for everyone's patience as we continue to work together to overcome this virus. From here, as we get ready to move into a new phase, we must remain vigilant and continue to push forward with solutions that protect the health and safety of our community. At the same time, we must put our people back to work safely. With the right tools and with your cooperation, we can have the courage to give our people the freedom to once again earn a living and provide for their families. We are in a position today to give Bermudians more choices and more freedom. But with more choices and more freedom comes greater responsibility. We cannot become lax and move away from the work which we are all doing to keep us safe. Wearing masks, maintaining physical distancing, washing our hands, and making sure that we do not hug, kiss, and embrace when we see persons while greeting. As the Minister of Health said, these actions could cause another outbreak and could force us to go back to where we came from, where I'm sure none of us want to go. We have not defeated this virus completely, but it is important as a country that we cannot let this virus defeat us. We have increased our capacity to take care of our citizens who may become afflicted with this virus. We have increased our capacity to test and detect, to trace and to isolate persons who may become infected with this virus. And collectively, as a leader of this government, I have the confidence that we can deal with what the future may bring. The truth is, however, that we must continue to be safe, we must continue to be kind, and we must continue to be patient. As more and more businesses open, we will see many changes in how we interact with each other at retail stores, restaurants, at our parks, and even at our beaches. We must remember that everything we are experiencing is new and unusual, but it is necessary to make sure that we can get more of our people back to work while making sure we keep our country safe. The days ahead and the economic challenges ahead will be tough. Our economy has been weaker, and there may be businesses that will not survive in the current economic climate. Our people and our institutions will feel economic pain. What this experience has taught us is that fear cannot stop us, differences of opinion will not paralyze us, but kindness and compassion for each other will take us further and faster. The opportunity before all of us as your government and the opportunity before us as a community is this: rebuilding our economy less in the image of the past. While successful, it did not always include everyone. We must build a new economy, one that is based on equity, genuine cooperation, and genuine collaboration for the benefit of all. On Thursday, more of us will be able to return back to work. And that is a start, but we still have a long way to go. We have come far together. Let us continue to work together for each other and remain focused on the goal at hand. And I have no doubt if we continue to act in the upcoming months as we have in the past two, Bermuda's success will be that we have successfully managed this virus while getting our people back to work. Thank you, and I'm happy to take any questions that the media may have at this time.
Good evening, Don Burgess, Bermuda Broadcasting. The bus service was supposed to resume today. When can the public expect it to start up again?
I have been advised that the bus service will resume tomorrow, and I believe there'll be a statement coming out from the government shortly on that. But the bus service will resume tomorrow, and there'll be further discussions between the Ministry of Health and bus service operators.
Thank you. Schools were supposed to reopen in phase 3. We see here phase 2 lasts till June 30th. What does that mean for public school students?
It is not correct to say that phase 2 will last to June 30th. I was very specific in my statement insofar as saying the reasons for this particular extension. Phases do not have a determined timeline, and I am determined that we will move to phases faster than where we end on June 30th. However, this particular phase is expected to last at least 2 weeks' time. That's the minimum time that the Ministry of Health says that you can judge the impacts of particular phases. And that takes us into next month. The current regulations expire at the end of May, as were issued by the governor. So we need to extend the current regulation a little bit further. As I said in my statement, I am hopeful that we'll be able to move further before the end of June. And so from that particular perspective, these things will be in place until the end of June. But as we've seen, the current regulations are in place until the end of May, but yet we are moving a little bit quicker. So there is still no defined timeline for those particular issues. And so as we have seen, licensed daycare centers are able to be open. Those are things which were supposed to be in phase 3, but we recognize that as more persons are returning to work, there is the need to provide that additional capacity and support. And as you would have heard in my statement, the Ministry of Education is organizing educational support for parents of children who may also be returning to work.
All right, thank you. A person who died on Friday was reported positive for the
I'm
virus.
sorry, I made an error in my statement. The bus service is to start on Wednesday, not tomorrow.
All right, thank you very
Public
much.
service workers are always working and firing emails very quickly whenever I make an error. Wednesday, not tomorrow.
A person who died on Friday was reported positive for the virus on the same day. Without wishing to sound intrusive by asking about a specific individual, we do think it's important to know when this person actually took the test and how long they might have waited before they could take the test.
That particular individual that you're speaking about did not wait at all. They actually were tested upon arrival at the ER department.
And according to the government's booking website, there is a wait of up to 1 week for the public to book a test at Southside. If a member of the public falls ill and worries that they may have caught COVID-19 and wants to get a PCR test quickly, what do they need to do to schedule a test as soon as possible?
Thank you, John. That's a very good question. They can speak to their physician, and then the physician can order for them to have a test. So there would be no delay. They would be able to get their physician to order the test. It's actually a great indictment, I think, on the emphasis that the government placed with respect to testing, that you have to wait a week to go to the testing facility at Southside because they are testing essential workers as well as persons that wish to just avail themselves of a free service. So I think that's a positive indictment. However, if an individual wants to have a test sooner than that period of time because of all the slots being taken up, they can make an appointment with their physician. The physician can order a test and they can have it done.
All right, thank you.
And I think with Don, it's important to note, as the Minister of Health said, there are 2 testing modalities. So still, for the physician's referrals, et cetera, are still going to Helix, and the drive-through testing facility, the MDL, is handling the drive-through for the members of the public. So certainly, as the Minister of Health said, if you are sick, don't wait to get an appointment at Southside. Call your doctor and deal with that, and you can handle that expeditiously.
Thank you. The BPSU has rejected a proposal by government for a 10% across the board civil servant pay cut. Union officials believe believe any agreement put for pay must come with reductions in the overall cost of living. What's your response?
My response is that first, I'm not going to necessarily say that the BPSU has rejected anything. We have not received any official communication from the Bermuda Public Services Union or any other unions for that particular matter. The second thing is that I must clarify, as I did before, that there is no reduction in take-home pay for public sector workers underneath what the proposal of which was laid out by the Minister of Finance. So when we speak about this whole 10% pay cut, it's important for persons to note that there was no particular reduction in take-home pay from public sector workers. And I think that it's two very important points to note. The members of the union inside of their electronic communication have stated the issues of cost of living generally throughout the country, and I do support that position.
I know in Barbados, Prime Minister Mia Mottley is looking at making its public service workers take a forced savings as part of their pay, and their money would be invested in bonds for the government that they could later redeem. What do you think of this option?
I haven't examined that option, and I'm not necessarily concerned with what's taking place in other jurisdictions. From the perspective of the government of Bermuda, the government has set out its position in private to our public sector unions, and we will wait to hear their particular follow-up. I think that it's particularly important that we follow that particular process, and I'm hopeful that we will arrive at a solution that is beneficial for the country.
Thank you very much.
Thank you, Don.
Good evening, everyone. Maya Plaster here for Media Maya. My first question is pretty lengthy, so I apologize. But last week, teachers were asked to disclose personal information about their health to the commissioner to determine if they could work in a school building. Today, the commissioner asked again for persons who fall under what is now known as extreme vulnerable persons shielding guidance to complete a form and have a physician sign off to it by tomorrow, May 15th. And my question is, why is there such a rush for teachers to complete this form?
I can't necessarily speak to a rush for the teachers to complete the form. I think the Department of Education wants to gather information as it makes plans and preparations moving forward. But I'm sure that if a teacher wasn't able to get that form in today and needs to get it in tomorrow or a few days, I'm sure that that won't be too much of an issue.
Okay, thank you. And my next question was, is there a money cap for unemployment benefits?
There is no actual money cap for unemployment benefits. However, the total amount that can be paid on a week is $500. So the actual plan provides 60% of income up to a maximum of $500 per week. And the maximum time that someone is eligible for that plan is 12 weeks in total. So that's the total time of eligibility, 12 weeks, and it's $500 maximum per week. But it is calculated at 60% of your earnings up to a maximum of $500.
Yes, sorry, I apologize. Let me reword my question. For the government, is there like a peak as to how much money can go toward paying unemployment benefit on
In the
island?
budget?
Yeah, in the budget.
No.
No. Okay, thank you. And could you say how many persons have taken out funds for their private pension as of today?
No one has taken out any funds for their private pensions. As I think is indicated that the issues have to go through a few steps, and I think that the last indication that the minister had when he was here on Wednesday is that it'll go through the Senate. Following going through the Senate needs to go ahead and get approved, and then guidance needs to be issued. So the plan was to allow that to happen at the beginning of next month.
Thank you.
Persons and then plan administrators would have about 2 weeks in order to release the money.
Okay, thank you. And my question for you, Minister Wilson, you mentioned earlier all the different processes of, nails and salons and hairs and everything. Can you please confirm for me, did you say that acrylic and gel nails was something that's a yes can happen?
That's correct. However, the add-ons, like some people, I wouldn't know, but some people get massages with the pedicure and those add-ons or the paraffin add-ons are not able to be, they're prohibited in this particular phase. So it would just simply be the acrylic nails and pedicures.
Okay, so that means no like washing of the feet and all of that for the pedicures. It's strictly just gel and.
That's correct. That's
Okay.
correct. And the guidance is being prepared as we speak, and it will be available for beauty parlors and salons at covid.gov.bm.
Thank you. And for persons who want to get salon appointments and barbershop appointments, like I'm saying now, they should be booking an appointment and should not be trying to do walk-ins, correct?
No. It's going to be by appointment, and there will be, in order to adhere to social distancing, there will be quite stringent guidelines as it relates to how many people can be in the salon at the same time. So it's certainly discouraged to be having walk-ins, because then they would be effectively potentially, breaking the requirements as it relates to the spacing.
Thank you very much. And my final question would be about Chevelle Dylan Burgess. Last week, Minister Keynes, you mentioned that some persons were going out on the boats and checking the shorelines. So my question was, how much of the shorelines have been covered, as well as the island, for searching for her?
Action to answer that question.
Yeah, I'll just cover a couple of points I just want to cover, because the shoreline has been addressed. The waters were in Bermuda. We have diving capability alongside the Bermuda Regiment. I'm extremely grateful to the local community who've come up with lots of very, very positive suggestions for us to follow. There's a couple of points I want to clarify, that we believe Chevelle went missing on the 11th of April, but we did not become aware from the police services perspective until the 30th of April. So over the past few weeks, we've obviously intensified our inquiries, our searches, and it's been working very much in partnership with the community. Today, I met Chevelle's family just to reassure them about what we were doing. We have family liaison support with them. And I continue to appeal to the public, if they have any information, to provide it to us. Our intention is to find Chevelle safe, well, and return her to her family. And obviously there's lots of things the police are doing that perhaps we can't share with the public. But my reassurance to the community is that I intend the BPS to do everything we can to find her.
Can I ask a follow-up? Thank you. My question is there how many persons, or are there any persons, if you can say, have been questioned about her whereabouts?
Well, it depends what you mean by question.
Brought into custody.
We obviously interview multiple witnesses, friends of Chevelle, family, people that have contacted us. So it is in the tens. It's not, we are progressing very intensely our inquiries. And obviously there are many other things that we do, some of which, as I said, that I'm not going to disclose during this press conference, but that should actually reassure the community.
Thank you.
Good evening, Mr. Premier, ministers. If I could start with a question for Commissioner Corbishley, if I could. In tonight's press conference, both Minister Keynes and the Premier issued condolences to the family of Mr. Santucci, who I understand is the man who was killed in the stabbing on Saturday night. Are you prepared to, I don't believe at this point police have released the name of the murder victim. Are you prepared to do that?
I mean, well, Mr. Santucci has quite an expansive family, and it's important that they're informed first, and the family are guiding us on that. So we hope to be able to do something in the next 24 hours. But as Minister Keynes said, we do have a person in custody. We do believe that there are only two parties involved, including Mr. Santucci. We believe that, and it was an altercation. My point in mentioning that is to reassure the community that we don't think this was a random, spontaneous attack. And obviously our inquiries continue as we go forward.
The person in custody, have they been charged at this point, or charges expected?
No, we're obviously still investigating, because due to the nature of the offence, there are obviously a lot of things that we need to get through first.
Understood. Mr. Premier, if I could turn my attention to you. Apologies if this kind of follows up a little on Don's question. Could you tell us if the BPSU proposal you spoke of on Friday, is it still on the table then? Is a different proposal being negotiated at this point? Just could you?
I'm not going to negotiate in public. The only thing I can say is that what was sent to the unions over the past last week, following our conversation, is the only proposal from the government of Bermuda. And to date, there has not been an official response from any public sector union.
So I think definitely good news. Bus is back on Wednesday, as you've said. Can you talk a little bit about, I guess, the service was supposed to start this morning. It was delayed because of a union meeting that was held. Was that union meeting specifically related to concerns about the resumption of the bus schedule?
Yes.
Okay. Can you talk about what, if any, concerns specifically were raised by the union?
I was not at the meeting, so I can't necessarily speak to that. But what I can say is that as for the communication of which I've received, is that the service will resume on Wednesday, and there'll be further discussions with the Ministry of Health regarding the physical distancing requirements. But I think I'll just speak on a broader level. And the broader level is that inside of this, I would say, crisis, is that many persons have their own opinions. And even persons such as myself, we have to listen to the advice of public health and the Ministry of Health, even though we may disagree with said advice. And so my view is that we certainly have to get Bermuda back up and running. We need to make sure that Bermuda gets back to work. And I would say that it is essential that as the government of Bermuda follows the guidelines from the Ministry of Health, that all departments of the government of Bermuda follow the guidelines for the Ministry of Health.
There's been questions tonight, I guess, concerning both the BPSU and the BIU. I'm wondering, generally speaking, how difficult is it for a labor government in striking a balance between keeping the unions happy and I guess doing what needs to be done in times like these to benefit the country from an economic perspective?
I don't actually think that our policies are judged by keeping the unions happy. I believe that our policies are judged by what is right. What persons may perceive as keeping the unions happy, it must be recognized that the unions and our party share a shared heritage, and we share a shared ideological position. So when I hear someone say keeping the unions happy, that just means that they do not support the positions of which unions may take. But from our view and perspective, ideologically, we are one and the same. We believe that we must make sure and recognize that there is past and historical injustice in Bermuda, and the place of which that past and historical injustice cannot be done is on the backs of workers. And so it is an important distinction to make. So I reject the premise of working to keep the unions happy. I think that in any particular situation, all persons are going to make sure that they protect the interests of either their members. I'm going to make sure that I protect the interests of the country. And these are the things in which we work through. But it's not a question of keeping persons happy or not. It's a question of doing the right thing. But ideologically, our positions are very similar. And so from that perspective, it's a lot easier for us to have those type of conversations and discussions. And I look forward to continuing them. Nothing is easy in this job. And I can tell you, being here for, I would say 34 months, it is certainly a challenge. But on any given day, we continue to get better. And every given day, I think that our union partners recognize the work which we're trying to do. And that's why I will say that we have not, to my knowledge, received anything official from any union. But I must admit that today I've been busy with caucus meetings, briefing members of the opposition, and getting ready to give my remarks today. So I'm behind my emails.
Sure. Just a couple. No, yeah. I'm sorry, I had more questions. That was.
Good evening. Let me piggyback on the last statement that you was talking about deductions, Premier. I understand that all members of Parliament receive $56,000, with ministers receiving an additional 100,000. That's 156,000 there or about, and you yourself is making some $200,000. That brings my total to $3,516,000. That's just with the 36 members on the House of Assembly. Wouldn't it be prudent? A 25% would be a deduction, would be a good example for the government, you yourself, the Premier, to take a pay cut with putting on the table 10% for the basic average man that's making somewhere between $50,000 to $60,000.
Thank you for your question. The first thing is that I must repeat one more time that under the proposal of which we've laid out to the public sector workers, no one will be taking home any less money. And as many many times as persons say, to make sure that I am clear that no persons will be taking home any less money. What I can say, however, is that as following our meeting of cabinet yesterday, and after conversations with both the government backbench and the opposition, we will be doing precisely and leading from the front of which we've asked public sector workers to do. So we will be tabling in the House of Assembly revisions to parliamentary pay, and that will be a 12.5% reduction and with an additional suspension to the Public Service Superannuation Fund for ministers, for members and officers of the legislature.
Good stuff. Premier Brett, another question I have for you, my second question. The decision made today for you to take us into phase 2, was that a complete, what might I say, cabinet support? Because I understand that you have received some pushback on not wanting to move members of your cabinet, not wanting to move to the next phase.
You know, Trevor, is the cabinet acts in collective responsibility. That's the reason why we have debates at the cabinet table and then we push forward. There'll be many different views and opinions that are expressed inside of cabinet, and none of us will share in public domain. What the decision of which was arrived at from the cabinet is to where we are, and that is the collective decision. And we will be moving forward because we are not fearful of the future. We have a great story to tell. The fact that our hospitalizations are down to 4, the fact that we have increased capacity at the hospital, the fact that we are one of the best countries in the world for per capita testing, and the fact that we have new technology tools at our disposal to help with the tracking, the tracing, and isolating, and we're going to be rolling out more things in the future. I think that we can, as a country, have confidence in moving forward. And I do not want us to be lured into the sense that we must follow the example of countries that had a far greater epidemic than we had here in Bermuda. We never made it to the point of community spread. We didn't do those things. And so our path has to be different, and we must chart our own course. And if there's one thing that I think the government must continue to expound, and the reasons why I gave these statements today, is that we are our own country. We can make our own decisions, and we can be confident in the fact the decisions of which we're making as a country, with the advice and with the feedback which we received, are the right decisions for our country.
Minister Keynes, with we have individuals that are guest workers here in Bermuda, that are landscapers, construction workers, beauticians. Would you be looking at, with so many Bermudians that are out of work that can possibly fill these positions, would you be looking at work permit holders with, and especially with them receiving benefits, so you know who these people are? Would there be any, I know you have to utilize the agreement that's been laid out, but will you be reviewing all work permit holders?
Trevor, that's actually a very good question. We have had the opportunity to discuss this as a ministry. We're looking at a staged approach to discussing this, have the opportunity to discuss a plan of the Premier and the Cabinet. After that is done, I will be happy to share with the public what we believe the next steps will be for our country with reference to immigration.
Thank you, Minister Golson. There's been a few people that, and I mentioned to you on Friday about a few workers at seniors' homes that have been tested, and they've had 4 more persons that stated that they still, after 2 weeks, still not have received the results from these tests. The anxiety that they're going through is tremendous. What can they do to get their results? Do they make a phone call to whomever?
Well, as the Premier indicated last week, and I'm not saying for you to share that information with me privately, publicly, excuse me, but as I understand it, the results that have been for the testing that's been done on Southside as of last week, all persons that have been tested the results have been shared with them and or their doctor. However, there have been challenges, as indicated by the Premier, with persons not necessarily putting the accurate email address, or alternatively not even listing the name of their doctor, because some of them hadn't seen a doctor for many years. So I think that they probably, at this instance, would be better served by contacting their physician directly, because, as I said, as of last week, they were all caught up to date with respect to providing that information to their patients. So there may be unfortunately, some type of error insofar as not listing the name and the proper address of the doctor.
If I may follow up, because I know that when it comes to resting homes, certainly employees and staff at various homes, if they were doing the testing, which was organized by the Department of Health, would certainly the ESU would have certainly received. Well, he's saying they haven't been received, so I can't possibly imagine that anyone who was a employee or a staff member, because those aren't people who are going for the drive-through testing. Those are being tested through the Department of Health's resources. And so it would sound very strange that those particular persons have not yet received their results. But as the minister had said, I think that you should certainly, those results have certainly been communicated to the doctors. And if the individuals who have those particular queries would follow up with the Department of Health, I'm sure that they could be directed appropriately in that regards. But I think the minister says to check with their doctor, because I'm assuming that persons who are working at nursing homes have doctors, and the doctors would have those results.
Thank you. My last question to Minister of Health. We have an employer that has a small business, and her question is, with this phase 2 about to take place, and if she has members of staff that come in that is showing signs of sickness, temperature, excessive sneezing, where would she refer these staff members to the Department of Health or to their personal doctor?
To their personal doctor, first and foremost. And I'm glad that that person is conscientious enough to ask that question, because if anybody is an employer and an employee of a particular establishment and they're exhibiting any type of symptoms or any sickness at all, they are encouraged to stay home. So they should stay home as that person has directed them, and that they should contact their physician prior to just showing up, and to discuss with their physician, what their medical condition is, but certainly don't come to work.
Okay. With that, I want to thank everyone, members of the media, for their particular questions. I want to thank all of you for your particular attention. As we move into phase 2 on Thursday, it is important that we are mindful of ourselves and make sure that we are not doing anything to put all of our collective progress in jeopardy. I look forward to addressing you further on Wednesday night, and I wish everyone to have a wonderful evening. Thank you and good night.
This is a message from the government of Bermuda.
Anyone can be infected by the new